If you're an A-level student, you've probably been conditioned to solely do active revision, which is better for A-levels because you're probably being tested on really specific information. And in that sense, active recall's better because it's better for long-term retention and memorizing specific facts. But I think what's often overlooked when it comes to medicine interview prep is the use of passive revision to actually supplement your active revision. And I'd suggest that the best way to go about this is probably doing about 70% active revision and 30% passive revision. To clarify what both of these terms mean, active revision is more so quizzing yourself, actively testing yourself on information you've already learned, whereas passive revision is solely absorbing information. What active revision looks like when it comes to medicine interviews would be maybe debating, mock interviews, flashcards on NHS hot topics and things of that sort. Whereas what passive revision would look like for medicine interviews is maybe watching YouTube videos like this one, reading articles, and things of that sort, where you're really just taking in more information than you'd assess yourself on. I'm going to talk about specific examples of which active and passive methods to do, but the reason why I'm bringing attention to passive interview prep is because it exposes you to quite a large breadth of content, which is really useful because you don't actually have to recall too many specific facts in your interview. I think having an awareness of a lot of things can really serve to your benefit, because you'd be surprised on how much you can actually recall when you're prompted about a topic, even if it's not, super in-depth mentalist sort of information that you're recalling. I think, it's just still really good to have an idea of information at least. It's better than having no idea, is what I'm getting at. So starting off with active recall, and I won't spend too much time on this segment because we're probably more familiar with it, but I will, direct you guys to active recall sources. You've got flashcards. The things I'd advise making flashcards on are maybe things like the 4 pillars, Gillick's competence, Fraser's competence, sort of keywords which you can bring into an interview. Things like dates of legislation I wouldn't really worry about. Maybe the 2010 Equality Act is a big one, but that's the only date I'd really worry about. Making notes. Notes is kind of contentious whether or not it's on the passive or active side, but making notes on topics before you start to test yourself on them is probably the way to go about it. Then you have mock interviews, of course, which is the main active recall method. I understand that for a lot of people like myself, if you went to a state school, you won't often find time for teachers to maybe mock interview you, and I think this makes a massive discrepancy when it comes to interview outcomes. So what I resorted to was, and this isn't like a partnership or anything, this is just generally me talking about my experience with a company called Dr. Admissions, which I'll put on screen now. I was able to do mock interviews with this company and even work in small groups, and they do university specific interview prep, which I found super helpful. The Nottingham one was really reflective of the interview I had with them, and it was really just the first time I was actually able to speak in a group about medicine and about public health, which is what I'm really interested in. So I found Dr. Admissions super helpful in that sense. I believe it's a company, but the specific doctor who I worked with, who I'll give a shout out to, is Dr. Afroza Ahmed. And overall I'd really recommend that service, so I'll probably link it in the description. Next up is debates, and this is a bit of a fun one. I just had some friends who were quite opinionated on things to do with the NHS and all of that, so I'd often find myself in arguments with them. But to be honest, I don't think this was extremely transferable to interviews. Interviews don't look so much like a debate. You might be asked follow-up questions, but it's not usually, in my experience, very combative. So to summarize, for active recall, you can do flashcards, notes, debates, and mock interviews. And the benefits of active revision is specifically long-term recall and better depth on specific topics. Now moving on to passive med interview prep, which we described at the start as just being absorbing information. The benefits, I'd say, is getting a good breadth of knowledge around topics relating to medicine, and it also, in my opinion, adds nice context to specific facts you learn about. Like, for example, you might use active revision to learn a lot about, Gillick's competence, Fraser's competence, but then passive revision of maybe watching, an NHS TV show, one of those A&E ones, where they actually assess a real patient as to whether or not they have competence, depending on the state they're in, age, anything of that sort. That's one of the benefits of passive revision, in my opinion, is that you just sort of internalize when the information is used, if that makes sense. But the main drawback, I think, is it's easier to do, so it might lead to you, messing up that ratio we talked about of 70% active, 30% passive. And doing too much passive revision can probably give you a false sense of confidence. So moving on to specific examples of passive revision I used. Starting off with YouTube channels, because there's a lot, and we spend a lot of time on our devices, so you might as well get in some passive revision when doing so. I found Dr. Mike's podcast super interesting. There was one debate in particular I watched between Ayurveda and Western medicine, and the key takeaways is, living in a Western country, oftentimes we look at Eastern medicine and think, it's not as effective, and while we can have grounds to believe that because there's less of an evidence-based approach, I think one important takeaway, which the person he was debating hammered on really, was about a personalized approach and the emphasis that Ayurveda puts on having a personalized approach to your patient, which overall I think is something really beneficial to adhere to for patient outcomes. And even though I don't think the NHS should be reformed with a solely Ayurvedic system, in an interview I can mention how that takeaway I think would lead to better patient outcomes. He's also really good when it comes to laying out his thinking as a doctor and the decision making that goes into it, and sort of what he aims to get out of consultations, because he's a family doctor in America, which I believe is the equivalent to a GP. The only disadvantage I'd give to him as a source of passive revision is that he's American, doesn't talk about the NHS ever really, but it's still interesting to consume some of his content. Next, another channel I want to talk about is Kurzgesagt, or In a Nutshell. When it comes to talking about mechanisms of disease, they're really helpful. Their animations are really easy to watch, and the narrator is quite informed. I don't know if it's a script or what it is, but he says really accurate information, at least from what I know. And it puts what you learn, or what you might be learning, because some of the topics relate to A-level biology, into real-world context, again, which is really helpful. It talks about mechanism of disease really well. Yeah, they put essentially stuff you might learn about at A-level, or even as I'm learning in med school now, into a real-world context again, which I think makes it really easy to apply to med interviews, just having it be narrated to you in a way which is more human, which is what happens in med interviews if you ever have to explain something. The next channel, which I used to watch a lot and still do now, is the Human Lab podcast. Now we're getting further away from sort of, specific UK med school revision interview prep, but if you want a good example of what public health can look like and combating misinformation which could be spread, America has a worse issue with that with RFK Jr., but that's for another day. If you want a good example of what combating misinformation looks like using an evidence-based approach, I think the Human Lab, good place to look at for that. In the rare event that he makes a mistake, he'll take accountability, which he's quite well known to do. And he always brings in specialists onto his podcast, which I think shows the importance of a team-based approach, because you're not a jack of all trades within medicine. You have to specialize very early on in your career, which often leads to you depending on other specialties, to get the best patient outcomes. Lastly, again, the only channel/company which is made into both segments of the video. Again, I'll talk about Doctor Admissions because they have a social media page where Dr. Afroza Ahmed talks about a variety. I'll actually pull up what she talks about. Yeah, but to summarize, I think passive interview prep is good when you supplement it to active revision. Again, if you're confused, in a ratio of about 70% active to 30% passive. The reason why passive revision can be really beneficial is it lets you get a large breadth of information, which when you're prompted is a lot easier to recall. I don't think passive revision could get you to the point where you could, talk about a topic for ages and ages, but if you were to be asked a question about it, having an idea is really beneficial in an interview. I was actually emailed about this. If you don't know much about a topic, as long as you know something, there's a way to navigate the question using terms like, if it is the case that this is true, then it would lead me to the conclusion of this. When you answer a question like that, you're forfeiting the idea of you being 100% correct on it or 100% certain. At least it still gives you the chance to outline a logical thought process. But obviously, in an ideal world, you know everything about every topic in medicine, but that's realistically not going to happen before your interviews. You will probably get stumped with a question, but the best way to avoid that and have a chance at answering it somewhat reasonably is some passive revision. Spend some of your free time on the way to school. I don't know when is most available, but yeah, spend some free time doing passive revision. I think if you need motivation, check your screen time. If it's anything. With that being said, thank you for watching, and if you have any more questions or something you'd like me to make a video about, please email it to me. I've gotten a lot of emails, which I'm responding to all of them, because again, interview season is now and it's fast approaching most of your interviews. So good luck with that, and thank you for watching.
I was broke, pocket full of lead. Now I'm on the bricks, getting paid like no other dog. Now I'm stacking chips on the road like a trucker, man. Had to take some trips, doing shows for my brothers, but strapped with extra clips.